we had a few technical difficulties there and lost audio for a little while. So I'm going to ask you a few questions, and I'm wondering if you would answer them. We may cover some of the information you've already shared, but I still think it would be good, and for the benefit of the audience, that when we lost that audio, they just may not have gotten the information. But how does the WHO decision to pause the use of this drug in its clinical trial impact the South Dakota study?
So I think the WHO is using it in a very different situation, and they're much more using it on the inpatient setting and those individuals that are critically ill. What we're doing in our study is looking at a very small dose of hydroxychloroquine in healthy individuals that have been exposed, and try to see if, similar to Tamiflu, it doesn't prevent you from getting the illness or prevent you from getting very sick from the illness. So we're giving a dose that's similar to what hydroxychloroquine is used for, preventing malaria. So if anyone has traveled to an area where there's malaria, they've likely taken hydroxychloroquine a couple doses before they leave, doses when they get back, to prevent malaria. So we're using that kind of a safe dose in those individuals that have been exposed to COVID.
So, Dr. Suttle, why is it important to continue the study that you're conducting when other studies have been reported to show no help and even harm, according to some reports that we've heard?
Yeah, and it's a good reason to always keep up with the literature and make sure that the question you're trying to answer is a good one. The reason why we need to continue this trial, and while this trial is so important, it's because it's at a very different stage of the illness. Much of the data that we've seen where it's shown hydroxychloroquine is proven to be harmful or not have any benefit has been on those individuals that are very sick with the disease and are in the hospital. The mechanism of action of hydroxychloroquine really doesn't make sense in those individuals. So I think we've learned something. We've learned that in the hospital might not be the right setting for this medication. There are several studies out there looking at prophylaxis or prevention with hydroxychloroquine, and this study is one of those.
So, Dr. Suttle, a lot of people have talked about the New York study, that it didn't impact mortality rates and that it wasn't effective. Can you reference specifically how your study is different than that study specifically? Because that's the one that's been covered so much.
Exactly. You know, that study was really kind of a registry. So it wasn't a randomized placebo-controlled trial, but rather it was looking at a bunch of cases of COVID in New York City with a lot of different things happening. And they were able to, what they're trying to do is pull out signals from a lot of data. And one of the signals they pulled out was patients in the hospital that were given hydroxychloroquine didn't do any better. The outcomes weren't any better. So registries, while they do help provide some of those signals, don't tell us a definitive yes, no. A randomized placebo-controlled trial is a definitive yes, no. We'll give 1,000 people a placebo. We'll give 1,000 people the hydroxychloroquine. At the end of the time period, we'll be able to tell, did the ones that got hydroxychloroquine not get COVID, even though they were exposed just like the others? Or did they get COVID anyway, so then hydroxychloroquine didn't work? Or if they did get it, were their symptoms significantly less severe than those who got the placebo? So it's a true head-to-head yes-no answer. The New York one is a registry looking at a lot of noise, a lot of data on a lot of things that happened in New York City. And what they were saying is, you know, with everything going on, these patients were getting a lot of different treatments. Those in the hospital getting hydroxychloroquine didn't do any better in terms of fatality rate. So it's good information. And that's why probably we're not looking to use it in the hospital setting so much anymore, and why the WHO had the reaction they did. That's not even a apples to apples comparison. We're doing something completely different. And I'm so pleased that we're collaborating to do this work. I think it's so important to be able to bring answers to the table and be a part of that here in the Midwest. So I'm grateful for the other two health systems to be a part of this work. And we've been meeting frequently, weekly, with their physicians and our physicians to kind of craft the right trial that still makes sense while looking at all the evidence as it continues to come out.
I think folks have also asked us quite a few questions about the study that often gets reported as a VA study. I don't know if that's the accurate way to report that study because I don't believe the VA even conducted it. But that's the way it's been reported many times in the press. But that study, they talked about it actually doing more harm and causing death. Could you reference that study and then inaccuracies of how it lines up with what we're doing here in our state?
I think pretty similarly to the New York study in terms of the VA study was really looking at inpatients, large numbers, not as well controlled, kind of a lot of different scenarios. So it'd be like trying to pick out if, 5 different makes of a car had the same safety record versus looking at only one make of an automobile. I don't know. That's kind of a an odd scenario, but it's looking at, you're not comparing apples to apples, but you're drawing kind of inferences. And that's unfortunately a part of what we have to do early on in the stage of a brand new disease is we're looking for any red flags or any signals, which is good. But there's never been any documentation or information from the CDC or the WHO that using this in a prophylactic randomized trial is putting patients at risk and is a concern. We're being very selective in the patients. We're making sure that they don't have any potential harmful heart conditions or anything that would put them at risk. We're carefully examining their medication list so that we know that there's no interactions with medications. So we feel very confident that this is a safe trial, that hydroxychloroquine is a medication, that the doses that we're using have been around for decades, and physicians have been prescribing it for decades in a very similar fashion. And we're being very careful, just trying to be a part of the science to potentially provide a solution.
We still get some questions of people wondering if this is taking medication away from patients who need it for the treatment of other diseases. Could you speak to that?
Yeah, and it is a concern. And I think very early on, when there was a lot of hype about hydroxychloroquine, there was concerns that there were physicians that were just prescribing it, thinking it might work. We early on as a health system talked to our physicians and said, don't know yet, we need to do this in a clinical trial. So let us put a trial together rather than just prescribing it to your patients. Please, we have patients that do need this medication, and we need to use this in a clinical trial. In addition, by doing it in a clinical trial, what the pharmacies have on hand is for prescriptions from physicians to those patients with medical indications like rheumatoid arthritis and the like. So as far as we know, we are not taking those supplies. And it was really your ability to go into that federal cash to bring that medication that we could do it in a clinical trial. So where this is a completely separate cache of medication that does not get into the pharmacy supply of medication, that still that chain of physicians prescribing for patients continues on. What we're doing here in the state of South Dakota is using that cash that from the federal government that the study will then supply that medication. So 2 very separate routes to get the medication.
Has the study in South Dakota been impacted at all by President Trump talking about this medication?
I don't think so. I think what it does is it just raises awareness, and it's an opportunity to communicate even more. Certainly an understanding of what we're doing and how we're doing it. It's complicated, right? All of these, I think clinical trials in general are. Understanding what's going on is complicated. So it just is a reminder to us to continue to communicate what we're doing, which is why I appreciate this opportunity. The more we can get the message out there of what we're doing and why and how we're doing it in a safe way, I think is important. And then it's always at the end of the day, the individual patient's opportunity and decision, do they want to be a part of the clinical trial? You can choose. And we are finding patients and individuals that are wanting to sign up for the clinical trial. So we will keep offering it as an option, and individuals can make that their choice and have a good conversation with a physician about what are the risks, the benefits, why we should try this clinical trial. They might not get the med, they might get the placebo. So, being a part of science is a wonderful thing.
Well, thank you for being here and answering questions. These are questions that our office and our Department of Health have gotten quite a bit, so we wanted to see if you would be available to address some of them, and it's been very helpful. Is there anything that you talked about in your opening statement that may have gotten cut out during the audio glitch that you want to just cover one more time to make sure that the folks at home have the information that they need?
I think your questions were spot on and really addressed all of those concerns. So I don't think that there's anything that I have to add. I would say if there's any questions and if they need information about enrolling in the study, I do have a phone number, and that is 605-312-6023. I'll say it one more time, 605-312-6023.
Wonderful. Well, thank you so much, Dr. Suttle, and to Sanford Research for your continued commitment to helping people that are affected by this virus. Having a therapeutic and a medicine that could help them gets us a long ways towards feeling better prepared for what's ahead of us and also getting towards finding a cure. So once again, thank you so much for all that you've done throughout this pandemic, and will continue to do, I'm sure. Get some rest.